Let's head into the papers now, see what the headlines are in Nigeria. I have Sheson Kwade, chartered accountant and public affairs analyst, joining me on Skype. We have to do the analysis via Skype this time around to ensure that we are complying with all of those precautions. Thank you very much, Sheson, for joining us on Skype today. Now, let's start from Daily Trust. Daily Trust newspaper said that 77 Nigerian health workers infected with COVID-19, Lassa fever, 9 doctors, 1 nurse dead. Why they are falling victims? There's some kind of explanations here. Tales of woe by caregivers. And experts want hazard allowance, life insurance for medics. All of this on the front page of the Daily Trust. Now, from there, let's go to the Blueprint newspaper. As ECOWAS seeks debt cancellation, Buhari wants leaders to see opportunities in COVID-19. Identifies agriculture, technology as way out, and halting immunization will trigger a pandemic. Akwa Ibom shuts hospital over doctor's death, and over 40 health workers positive. 500 violators convicted in Abuja. That's what you see on the front page of the Blueprint newspaper. Now, Daily Times, on the other hand, says the federal government to health workers don't treat COVID-19 patients without PPE. All right, that's personal protective equipment. Says 40 health workers have tested positive for coronavirus and deploys 17 health workers to Kano to combat pandemic there. You find all that on the front page of the Daily Times. Nigerian News Direct is the next one we're seeing now. COVID-19, 40 health workers tested positive. The Minister of Health is saying this. And U.S. funding assistance to Nigeria hits $21.4 million, as the embassy is saying this. And no plans to open schools for third term. Oshun imposes use of face mask in public. All that on the front page of the News Direct. Now, Leadership newspaper is the last one now that we'll be looking at. And certainly, coronavirus is the headline here. Infected persons shun isolation centers. And it's our biggest challenge, says the federal government. Orders private hospitals to apply for accreditation and considers governor's interstate lockdown plan. 40 Nigerian health workers test positive for coronavirus, and CACOVID to train experts in curbing community transmission. And PMB emerges ECOWAS COVID-19 response champion. That's the President Muhammadu Buhari. This was done over the extraordinary meeting of ECOWAS heads of government. All right, Sheson, I know the story on the Daily Trust and some other papers here would interest you, talking about the number of doctors that are testing positive. Over 40, or roughly about 40 of them testing positive for COVID-19. Now, this brings us to the issue of the insurance cover for medical workers, as well as hazard allowance and all of that. What do you say?
Yeah, thank you very much, Mike, for having me around. And Ramadan Mubarak to all our Muslim faithfuls.
Yeah.
Going by what you just said about the health workers, it's part of what we have been saying before now on having insurance policy for the people that work not just only in the health sector. It's because we are just having this particular one. That's why we are having that concentration all over, that they should have that and hazard allowance. Most people who engage in essential services that is beneficiary to humanity are supposed to have this insurance cover, because whether you like it or not, they are sticking their life for the benefit of other people, and they must be compensated for it. Look at the scenario that we are having, the foot soldier that we have in front to protect and treat people are being infected and need to be treated. So what is happening is that we are putting so much pressure on this health practitioner, which in turn will affect the majority people who may be contacted, because we discover like the 40 that have just been discovered by the Ministry of Health needs to be isolated and be treated before they come back and treat other people, which in turn create a shortfall in the number of personnel. You know, before now we've been complaining that we don't even have enough health workers to take care of us. Now, the people that are taking care of us are even falling victim of it. And it goes down to the aspect of not even having sufficient PPE for those people. It's really not possible for them to have it and not use it. But part of the things I've known, because I'm part of the essential workers in the power sectors too, is that you can't be too careful. You will not even know when some of this thing will happen, despite your being careful. So it's just a matter of preaching more carefulness to people, and again, informing our people to adhere strictly to the set rule. Distance. You see, even government are not helping matter, Mike. If you look at some of the things that we see on air, the gathering of government functionaries, you see a governor coming out and everybody is rallying around them as if they must protect them, as if somebody wants to attack them. With this, you discover that so many things are going wrong, and they should just please ease the tension on the health workers. These guys are doing pretty job, doing wonderfully well, but we must watch them and make sure that their life are safe too.
All right. One other area is the issue of training of doctors. We know that the African Union, in collaboration with World Health Organization, had trained some doctors in Lagos and Abuja. The NCDC has also, carried out some reorientation packages for doctors. But how much of that do you think needs to be done? Now, the Minister of Health is calling for all doctors that they should or must use the PPE, personal protective equipment, before they come in contact with anyone who has or who is suspected to have COVID-19.
Yeah, with the nature of this COVID-19, I expect that every doctor, every health worker now, whether your hospital is meant to treat COVID or not, whether you are administered to treat or not, you must use PPE. Look at what Lagos State government is bringing out, that most likely will commence next week, to start using nose masks. I want to suggest that, because some of this thing, you may be carrying it and you don't know, and you just go to the hospital to probably be treating malaria, or you feel you have just little infection, and it turned out to be COVID-19. If the health workers are not taking the necessary precaution of using the PPE, I think it's now compulsory. It is not issue of it must be enforced. The nurses, the cleaners, everybody that work in the health sector, before you attend to anyone, make sure you put in the PPE, protect yourself first, because it's when you are alive you can continue with the work and satisfy the calling which God has given to you. I want to use this opportunity again to encourage Nigerians. It is high time we stay at home. You see, the lockdown has it's been relaxed kind of. You see people playing football, you see people going around, people still have handshake, people still hug themselves. It will beat your imagination that these are happening. These are happening. You know, for weeks now, I've been off here, and I decided to just do Skype, because I tell you, I don't want to see anybody, and I don't want anybody to see me. I need to protect myself first, because when there is life, there is hope for me to even enjoy the benefit of everything. So I just want our people to adhere strictly to the rules, and I know with this, we'll definitely end the pandemic.
Of course, this is one of the recommendations by World Health Organization and even the Ministry of Health and NCDC. Stay home. Like you don't want to see anybody, and nobody should see you. Thank you very much, Sheson.
I'm ready to be on my own for
Thank
now.
you very much. Thank you very much, and stay safe. Thank you for your time on the program.
Thank you for having me.
Let's head into the paper, see what the headlines are this morning. I have with me on Skype Sheson Kouade. He's a chartered accountant and public affairs analyst joining us. Sheson, good morning. It's good to have you join me via
Good
Skype
morning,
for the
Mike.
paper review. Thank you very much. Let's start from Daily Trust newspapers. 77 Nigerian health workers infected with COVID-19 and Lassa fever. 9 doctors, 1 nurse dead, while they are falling victims, and some kind of explanations there. Tales of woe by caregivers, and experts want hazard allowance and life insurance for medics. All that on the front page of the Daily Trust. Now, Blueprint newspaper is the next one now. As ECOWAS seeks debt cancellation, Buhari wants leaders to see opportunities in COVID-19 and identifies agriculture technology as way out. Halting immunization will trigger pandemic. Akwa Ibom shuts hospital over doctor's death, and over 40 health workers positive. 500 violators convicted in Abuja. That is what you see on the front page of the Blueprint newspaper. Now, Daily Times is next. The federal government to health workers: don't treat COVID-19 patients without the PPE. And it says that 40 health workers have tested positive for coronavirus and deploy 17 health workers to Kano to combat the pandemic there. Nigerian News Direct is the next paper we're looking at now. COVID-19 is the focal point here. 40 health workers tested positive. The Minister of Health is revealing this. U.S. funding assistance to Nigeria hits $21.4 million. The embassy has revealed. No plans to open schools for third term. Osun imposes use of face masks in public. That's a Nigerian News Direct. Leadership newspaper is next. Coronavirus is here. Infected persons shun isolation centers. It's our biggest challenge, say the federal government, and orders private hospitals to apply for accreditation and considers government's governor's interstate lockdown plan. 40 Nigerian health workers test positive for virus, and COVID to train experts in curbing community transmission. And PNB emerges ECOWAS COVID-19 response champion. Okay. Sheson, let me come to you on this. The story on the front page of the Blueprint newspaper says, as ECOWAS seeks debt cancellation, Buhari wants leaders to see opportunities in COVID-19. Talking about opportunities. Now, the President Buhari has been made the coordinator or the champion of the response against COVID-19 in the West African region, leading other heads of states on what to be done. Certainly, Nigeria has the greater capacity when it comes to the level of response, what it takes, expertise, and the resources to contain all of this, if you compare them to other African countries. But talking about those opportunities the president was talking about, what do you think are the opportunities that we can take advantage of that now that we have COVID-19, as the president puts it?
Yeah, thank you very much for having me, Mike. It's inevitable. COVID might look like something that is pandemic, but there has been great opportunity since we started experiencing this few weeks back. If you look at it, it has brought so much of innovation, so much of creativity. Look at it, who can believe that we can, in our own state, develop, in our own nation, develop our personal, our PPE, things like hand gloves, things like nose mask, and every other thing. When you look in the business angle, you discover that lockdown has been there, but business has been moving on with the introduction of new technologies. Look at the meeting that was held yesterday with the ECOWAS. It was via technology, and everybody was able to have their fun. So it's going to tell you that after this COVID, you'll see people, because what that has impacted on is going to minimize the risk. You don't need to travel and fly to a certain country before you have your meeting. You know, those days we have to leave as early as 5:36 to start coming to TVC. But these days, technology has bring us very close to ourselves. So you discover that so many of these, even see the creativity in the religious world now. People stay at home and they have the blessing of their pastors doing things. So in the business wise, you see creative the webinar page, people are giving lectures, people are doing a lot of things while they're at home. So it's to tell us that if this COVID goes, we are going to look inward and see what we can do for ourselves to make the country to go forward.
So that means local producers of all sort of things will gain patronage. Now, one other very critical aspect is the area of major and critical infrastructure when it comes to health, especially at this time, as well as education and even roads and housing and all of that. Now, since countries are locked down, it means less importation is going on right now, that countries are also doing lots of internal alternatives, finding internal alternatives. When it comes to focusing on agriculture, focusing on infrastructure and other local industries, how much of an advantage can we take of when it comes to looking at it from this window, COVID-19?
Yeah, if you look at our infrastructure in the health sector, you'll discover that within few days, we can see state government putting up infrastructure to take care of some of these issues. Is to tell us that if we have the political will to do some of these things, it's achievable. But because before now, there is no driving force to put us on our toes, we feel it's a difficult thing. You discover in a state people putting up isolation center that can take care of 100 beds just within 2-3 weeks. And not just one, not just two, you are doing that for like 7, 8, and those things are being set up. When you look at other aspects of aid, it's very much possible. But what we have lacked before now is that we are not proactive. We are always reactive. It's like when we see something coming close to us, that's when we take steps to see how to nip it on the bud. But this has opened our eyes that we need to prepare ourselves. Because now nobody wants to travel out. In fact, nobody wants to welcome you outside the country because they don't know what is going on. So you need to look internally, look inwardly, develop your infrastructure to accommodate you, because you might be the next victim. You might be the next victim. And I can see that it's passing a serious message to our politicians that they need to develop the infrastructure that we have now, because it might be their turn the next time.
All right, Sheson Kwade, thank you so much for your time on the program this morning. Thank you.